Weight loss ads are everywhere you look, online, in the stores, and on TV. While there is a healthy way to lose weight and keep it off, there are many wrong ways that could be potentially dangerous. Today on Stronger Together, I'll speak with several Catholic health experts focusing on nutrition, exercise, and surgery who will help separate the myths and the facts when it comes to healthy weight loss. You're watching Stronger Together with Dr. Dave. Hello and welcome to Catholic Health Stronger Together with Dr. Dave. Today we are talking about weight loss and specifically the right way to approach it. My first guest is the Chair of Surgery at Good Samaritan University Hospital, Dr. Pratibha Vemulapalli. Dr. Vemulapalli, thank you for joining us today.
Great to be here. Thank you for inviting me, Dr. Dave.
So we are living in some very interesting times when it comes to weight loss. We have 74% of Americans suffering from either obesity or being overweight. We have a whole new class of medicines, and we have surgical options, bariatric surgery. So you're a surgeon, so I would like to get your perspective on where does surgery play with all these other things, exciting developments coming up and more in the pipeline?
So, surgery is now becoming the tried and true method of weight loss, and the drugs are certainly newer on the scene. Surgery's been around for 30 years, well proven, safe, really great outcomes for patients who have tons of medical problems, for patients who need to lose that weight. To take a step back, obviously, weight loss is key. Weight loss helps people live longer. Weight loss helps people live better. And that's why we've always been so focused on weight loss. It can get rid of the medical problems, like the diabetes that we always talk about, but it can also help get rid of the pain in the knees. It can help get rid of, headaches. It can do all that stuff. And that's why weight loss is great. That's why that whole concept of ideal body weight came up with the Metropolitan Life Company, right? What weight do people live the longest at? So even back in the 1920s, people were focused on what's the right weight. And I think we've gone through a lot of iterations of that. What surgery helps you do for people who've had yo-yo diets, for people who have had all these issues with weight loss, surgery helps take their weight down. It kind of reverses the clock. That's what I always tell my patients. And you go back to a time where you weren't so overweight and you can kind of start again. The most successful patients, even with surgery, are those patients who are going to then take that weight loss and really incorporate lifestyle changes.
Right. That's the key, that we have to make sure that once the weight is down, we are practicing or changing habits that may not have been so beneficial for their weight.
100%.
Yeah. You said something very interesting, and it just occurred to me. So, we have these newer class of medicines, but the key word is newer. They really are relatively new. They've only been out for a couple of years now, right? So. Yep. Bariatric surgery has been tried and true. You mentioned 30 years. What is your discussion with a patient who comes in and says to you, look, I'm on the medicine. I'm trying to decide, do I take a weight loss medicine or do I do the surgery? How do you advise these patients?
So, it's for weight loss surgery, right? Or that big broad category that we call bariatric surgery. Life is very different. We did surgery because there were no medications. Now medications have come on the scene. In any other disease state that's out there, we've always done medications first. And then when medications failed, then we graduated to surgery, and we did that. Makes sense, right? You do the thing that's less scary, that's less, what's the right word? That's less scary, that has lower complication rates.
Right. Less invasive.
That's less invasive, right? That doesn't cross too many bridges. And if that doesn't work, then we step up, right? We step up to something that's a little bit more serious. We do that in cardiac surgery, right? Like you come in, you see your cardiologist, they put a stent in if you need it, they put you on medications, and when that fails, if you need it, then you go to cardiac surgery.
Right.
With weight loss, we're now kind of falling back into that pattern of tried and true medicine, which is probably the right way to go, right? People should try medicines first and see how they do, get a moment or a chance to really try the medicines, lose some weight, rethink things, change some of your lifestyle habits when you can. And if that doesn't work, or you yo-yo with the medicines a little bit, then going into surgery with, your eyes wide open, understanding the lifestyle changes that you need to make this final option, I think, more successful.
Right. And, I think something that I'm not aware of any studies that are comparing bariatric surgery to these newer weight loss medicines versus maybe bariatric surgery with the weight loss medicine. So, my intuition is that I think ultimately surgery won't be replaced, but I think it would be more of a hybrid approach maybe. Maybe we will do surgery, a different type of surgery with the weight loss medicines for X number of years, and then, hopefully they can sustain the weight loss. Where do you see that? Do you think medicines and surgery will be married together, or do you think?
I 100% think that's exactly how we're going to go. I think, that patient is going to come in. We'll talk to them about surgery. We'll we'll get them ready for surgery, help them make some of those lifestyle changes. We'll do the surgery, right? The surgery will then help them lose the weight. And then when the surgery effects kind of taper off, because there are a lot of studies out there that show that surgery has some of the same hormone effects that the medicines have, especially in the beginning. And when that starts to taper off, we'll add the medication. And you'll have a surgery plus a medication to help you maintain that effect that you had with surgery.
Interesting, very interesting. And surgery to me is very scary. So we were speaking before we went on air, and you mentioned that the surgery is the recovery. They're home the next day after a typical bariatric procedure. Tell me a little bit more about that.
Typically, regardless of what bariatric procedure we do, most people are home the next day. These surgeries are done minimally invasive, meaning most of the incisions are no bigger than this pen. The biggest incision is probably about 1 centimeter, so it's not pain after surgery. Most people, even if you're 60, 70 years old, you're getting up the day of surgery. You're going to the bathroom on your own. You're getting in and out of bed on your own. You're leaving the next day, doing all those things at home for yourself. The biggest recovery, I always tell patients after surgery, is not the pain. The pain goes away pretty quickly. It's getting used to this new diet, right? We've changed your stomach, so you can't eat as much, you can't drink as much at one time. The clues to being full are a little different. I always tell people, it's kind of like when you have a newborn child and you're trying to feed your newborn child and you're trying to get the clues of when is your child full. So you're trying to figure out when are you full, because all of those sensations are different. Right. That's the biggest thing after surgery.
It's interesting. It's very similar to the medicines too, because people are learning how to eat again, essentially.
100%.
How much? Yeah.
100%.
Where's the future of bariatric surgery? What are you excited about?
So I think bariatric surgery, and there's the tried and true procedures. There's the sleeve gastrectomy, there's the gastric bypass. I think they work extremely well. I think where bariatric surgery is going to be going is what we call endobariatric procedures. What that means is we're going to start with things that you go in, just like you're going to have an endoscope, and we'll put an endoscope down, and through the endoscope, we'll end up stitching your stomach, not removing a piece of it, but stitching it to give you almost like a sleeve, but from the inside. You'll wake up, you won't have any incisions at all, and you'll go home the same day.
So you're reducing the stomach size without cutting any of the tissue out, any of the stomach out?
No cuts whatsoever, just sewing. No cuts on the inside, no cuts on the outside. Essentially, like I said, you wake up and you go home, and there is still going to be that getting used to eating differently, which takes time. I don't want to undersell it or tell you that that's easy, because it's not. That's the hardest part of the surgery, of any of these surgeries that we offer. But I think that's where the first line of surgery, or endosurgery, is going to be.
That's so cool. Is it reversible if they cut the sutures, or do those sutures scar over time?
So those sutures are supposed to scar over time, so they should be there permanently. Is it reversible? It's 100% reversible. We would have to go in and do a surgery to reverse it laparoscopically. But yeah.
It's very interesting. It's very exciting.
It's actually a very exciting time to be in medicine. I mean, the drugs are exciting.
Yeah.
I think these new options are exciting.
Yeah.
I think some of the ways we kind of help people get back on track when they've had surgery and they're not losing the weight or they're having reflux, it's exciting. It's exciting to be able to help people achieve their goals.
Absolutely. And so you're with Catholic Health, obviously, and if a patient is struggling with their weight and they want to talk more about their options, surgery, medicine, how do they get in touch with you? What's the easiest way?
So call the office. I'd love to see you. Like I said, I've been doing this for 20, 30 years, and one of the most rewarding things is really helping people get to their goals.
Yeah, excellent. That's a great way to end this segment. And since it's a moving target, we're going to have you back on.
I would love to come back.
Okay, thank you so much for taking the time out of your busy schedule.
Thank you.
Coming up next, we'll discuss the role that nutrition plays on your weight loss journey. You're watching Stronger Together with Dr. Dave.
As a mom, I want my kids' lives to be filled with joy and possibility, and I want that for every kid. That's why I support No Kid Hungry. They work in schools and communities to make sure every kid gets the healthy meals they need. Please join me in supporting No Kid Hungry for all kids.
Thank you!
Welcome back to Catholic Health Stronger Together with Dr. Dave. We just learned about the medical and surgical options available for weight loss. Now we're going to discuss the role nutrition plays. Joining me is Dr. Robert Graham, Medical Director of the Integrative Medicine at Catholic Health. Dr. Robert Graham, welcome back to the show. I'm so excited to have you back.
It's a pleasure to be back.
So why did I invite you back? Because we have a major issue in this country, and you are the guy I trust probably more than anybody to speak about this issue, and that's the fact that 74% of Americans are either overweight or obese. 74%. So the majority of Americans are struggling with their weight. What's going on?
I think we all struggle with our weight. I think there's a lot of misconception out there about the way to lose weight. I've always believed that the greatest side effect of a healthy lifestyle is weight loss. Mm-hmm. So you focus on the lifestyle and the weight loss will come off.
Right, very interesting. So you think the target is the wrong target. We're focusing on the end product, the weight loss, but in fact, maybe we should be focusing on the process.
Yeah, I think you have to get to the root cause of why you can't lose weight or why you hold on to weight, really to get to the root cause of why we are overweight or obese in our society.
Okay, so if I'm a patient who's struggling with their weight and I come to you for a consultation on how to quote unquote lose weight or just be healthier overall, what's your approach? How do you approach somebody like that?
Well, I think the first thing we have to sort of is address what are some of the misconceptions. So the theory of calories in, calories out is just bygone. 100 calories of broccoli is not like 100 calories of Coca-Cola, right? And so that's the first thing, sort of dispelling myths. The second thing, I believe, that we have to approach of the root causes. So in our Center for Integrative Medicine, we look at the role of hormones, the role of the gut microbiome, the role of your diet, the role of your culture, the role of sleep, of stress, and how that sort of lifestyle or those risk factors contribute to the inability for us to lose weight or us gaining weight.
Right, so this is a totally different approach than people are reading on social media or their YouTube channel. You are really looking at it from really a physiological and medical perspective.
But it's a holistic way.
In a holistic way, right, of
Yeah,
course, which is probably just good medicine in general, right?
Correct.
So that makes perfect sense, but today we have a class of medicines called the GLP-1 agonists.
Yeah.
And it seems like everybody is asking about these medicines. I know you've been getting a lot of questions about it. If I were to come to your office asking to be put on one of these medicines, how do you approach somebody like that?
Well, I think the explosion of these medications has been a medical revolution, really. Mm-hmm. I've been in practice for 25 years. What these drugs can do, I can't do, right? Particularly in the time frame. But if the goal is weight loss, all diets work, right? You can go on a vegan diet, a carnivore diet, a paleo diet, a fasting diet, if the goal is weight loss. But really, that I think is often preferred as a front door. Mm-hmm. So it is part of our toolbox in medicine, right, we have the ability to prescribe medications, but we also have the ability to engage patients in this behavior change, changing their lifestyle, and really getting to the root cause of why we are overweight or obese. And so our approach is very sort of conventional. You see the doc, right, and they will do a formal assessment, like your typical history and physical, but we will dive into, as I mentioned before, the food, the relaxation, the exercise, the sleep, and the happiness. Because we also know that communities that tend to be overweight tend to be overweight. And so if we can change how we are as a society, we'll probably get to where we want to be as a more fit, healthier country.
So do you use these newer medicines, and the ones I'm referring to would be Wegovy and Zepbound.
Correct.
You use these medicines not as a solution, but maybe as a tool. What is your approach?
Yeah, so the way we describe it is an on and off ramp, right? And so if you have to lose significant amount of weight, we will put you on a GLP-1, but we also encourage you to be part of our program. And our program will address these, again, 5 pillars or 5 ingredients in your recipe to health. We have to sort of understand that there are certain consequences while on them and while coming off of it. The biggest problem we're seeing here is that our gastric, our stomach, our GI system slows down, and we feel full. And that is part of the reason why we're not as hungry, and that's the reason why these drugs can work as well. But they also alter our microbiome. And so
hold on, what is the microbiome?
Yeah.
For the viewers
Yeah.
watching, when you say microbiome, what is that?
So the microbiome is this living environment inside our gut. There are actually more cells that live, bacteria, viruses, parasites to a certain extent, that live in our gut than we have as human cells.
Okay.
And so this symbiotic relationship between our gut microbiome, this living garden inside our body, in particular our gastrointestinal system, and how that interacts with our general overall health and well-being.
Right, so a healthy microbiome tends to create a healthy person or environment.
Yeah, and the research is finally catching up to the old adage of Hippocrates. You know, he said all diseases start in the gut.
Yeah, that's interesting.
Yeah, and he also says let food be thy medicine, right?
yeah.
But one of the things that we're identifying is that these drugs do have a powerful impact on our gut.
It may be a bad way, in the sense that you're feeding the gut, hopefully with healthy food, right? Almost like a garden.
Yeah, and that's probably one of the most common questions we get. Yes, give me the drug, but what can I eat? What can I do while I'm on these drugs? And as we're learning more about some of the consequences of these drugs, the weight loss is just not all fat, right? And it's usually a 75-25% rule. That's what I tell my patients. You will lose, if 100 pounds is the goal, you will lose about 75% of your weight in fat, but 25% in muscle, lean muscle, right? And so that's why we don't want to sort of use this as a panacea,
Right.
without engaging your food, your exercise part of our plan. And that's what we do in our offices. We really address the weight loss, but also the lifestyle that supports the sustainable weight loss that these drugs can achieve.
Right. What makes me very nervous is that it is so easy to get these new weight loss medicines online. But there doesn't seem to be much monitoring. The patient takes the medicine, maybe there's a quick visit, a virtual visit, a telehealth visit, and not much more. Where do you see that? What is the issue with that from your expertise?
Yeah, so we're seeing, again, going back to the question is, what should I eat, doc? Right? And now we're realizing that these drugs do cause impairment in our gastric system, our GI tract, our gastrointestinal tract. And we're seeing micro and macronutrient deficiencies. What we recommend for patients to consume while they're on these drugs is to combat some of that muscle weight loss. So more higher protein, lean protein, both animal and plant-based sources of protein, fruits and vegetables, non-starchy vegetables to start off with, but really trying to get your micronutrients from the vegetables and the proteins from both lean protein sources and plant-based protein sources.
Gotcha. And when you say micronutrient, we're talking you're measuring things like B12, magnesium, vitamin D.
Yeah,
These are important things, right?
Absolutely.
You can't just take a medicine and not have lab work.
Absolutely. And so that's sort of our program. We do a initiation of medication screening. So we will do comprehensive blood work looking at your vitamins, your B12 vitamins, your vitamin D vitamins. Iron, for example, is very commonly sacrificed on these medications. And we also do a microbiome test. We also do what we call a SIBO breath test. We're often finding that patients have bacterial overload,
Interesting.
in their small intestine, which impacts their absorption of nutrients. So it's really trying to get an understanding of what the patient's baseline is before we initiate these drugs.
Got it.
And then while on these drugs, monitor them, put them into an exercise program so they reduce the risk of that lean muscle mass. And then as they're sort of coming off these drugs, either because of cost, or they achieve their weight loss, there has to be some sustainable long-term solution to maintain and sustain this weight loss.
Yeah, there's no way I see the American population, 74% of the American population, being on these meds forever. It seems absurd. I mean, economically, it's not feasible. It just doesn't seem feasible from a common sense perspective. So
Yeah.
what I think you're saying is so important. Nobody's saying this is, yeah, okay, we embrace these medicines, they work, but what's the plan long term? We gotta consider getting you off of these medicines and hopefully supplement it with good habits, right?
Yeah, and you see, I think the more and more people get on these medications, it's sort of a lived experiment, right? As more and more people come on these drugs, we're going to see some of the unintended consequences of these medications.
Right.
Just simply because we have more people using them. Everything from bowel obstruction, constipation, acid reflux, bloating. There's a connection to mental health as well. Immunity, hair loss. There's a lot of things that are starting to come out as potential consequences of long-term use of these medications. Most of the studies have shown that these drugs should be used for anywhere between 12 to 18 months with an understanding, again, of an off-ramp.
Right, absolutely. So well said. And that's a great way to end this segment. So where can people reach out to you? Because I know there are a lot of people watching this show right now who have been contemplating these medicines, and you would be the perfect person. So where can they contact you?
Oh, thanks. We have a center, Department for Integrative Medicine and Optimal Health. And the number is 516-302-8535.
And we're definitely going to have you back for a three-peat.
Awesome.
Okay, thanks for joining us
Thanks.
today. That was some great information on the role that nutrition plays in losing weight. Next up, we'll learn about how exercise can help and how you can incorporate it into your everyday routine. You're watching Stronger Together with Dr. Dave.
Hi, I'm Susan Lucci. I never thought about heart disease until I had my own heart event. I never had a health issue, but suddenly I had that pressure, the elephant pressing on my chest. I had a 90% blockage in my main artery. I received 2 stents in my arteries. Stents developed through research funded by the American Heart Association. I'm so grateful to the American Heart Association. Their research helped save my life. Learn more at helpheart.org.
Welcome back to Catholic Health, Stronger Together with Dr. Dave. Today we've been learning about different approaches to weight loss and separating the myths from the facts. We've learned about the medical and surgical options as well as the nutritional approach to healthy weight loss.
Many experts consider exercise in and of itself to be actually a medicine with very few, if not any, side effects. It's really the only thing that we have that really resembles a magic bullet as far as its beneficial effects on the entire body. So the way we think about exercise, I think, needs to shift more and really consider it more like a medication, like a medicine with universal benefits. With GLP-1 agonist medications, which are very effective in weight loss, and actually we now know that these medications are also provide beneficial effects for metabolic health, and they can help individuals lose weight fairly rapidly. However, one of the risks or downsides of GLP-1 agonist therapy is actually loss of lean muscle mass. So exercise has a role to help counteract that effect because we really want to lose body fat and visceral fat around our organs, right? For our metabolic health and our just overall health and longevity. So if we combine the therapy with exercise, we can actually minimize some of that loss. So that's one. And just overall, right, for overall health and metabolism, we know that exercise is going to benefit. So eventually patients will come off of weight loss drugs. They may reach a targeted weight, but if they don't maintain healthy lifestyle habits, including exercise, then they're probably going to, lose all the benefit from the medication itself. The two main types of exercise, essentially, we have aerobic exercise. Most people think of that as cardio exercise, getting your heart rate up and your breathing rate up. And then there's resistance training. We actually know that both types of exercises are, beneficial for your overall health and well-being, how long you will live. Aerobic exercise, in particular, has a beneficial effect on a biomarker that we call VO2 max, which essentially is how much oxygen that we can utilize at an intense activity level. It's a very strong marker for cardiorespiratory fitness. The higher our VO2 max, the better our cardiorespiratory fitness. The better our cardiorespiratory fitness, the lower our all-cause mortality is, for really meaning all disease, right? So the longer that we will live, it's a strong predictor of how long we will live, our VO2 max. We get that from cardiovascular training, aerobic exercise training. There's also resistance training, which we actually know may actually be even equally, if not more important for our metabolic health. Right? Our musculoskeletal system, our muscles, are essentially a metabolic sink for glucose or sugar. It helps, resistance training helps our bodies absorb that extra glucose that's circulating in our blood so that it can be utilized, right, in the muscle cells themselves. So it helps us become more sensitive to a hormone that we call insulin, which is the master hormone, mainly involved in glucose metabolism and allowing the glucose to be go within the cell and mainly in the muscle cells. About 80% of the circulating glucose in our bodies gets absorbed or taken into our muscles. So having resistance training is going to help optimize that effect. So both are probably equally important, I would say. It's never too late, and it's something that really, if you're looking to do something proactively to improve your health, it's probably the best thing you can do for your overall health and well-being that will help you live longer and healthier.
That is all the time we have for today, but I hope this information will prove to be a helpful guide to you and your loved ones who may be exploring different weight loss options. If you would like to know more about Catholic Health or to make a gift in support of one of our amazing programs you heard about today, please visit CatholicHealthLI.org or call 1-855-CHS-4500. Thank you for watching today. I am Dr. Dave DeGuide, and I'll see you next time on Catholic Health, Stronger Together with Dr. Dave.